Memamu akwaba eba health matters dwumadie so aha ye bia ye twetwe apomuden ho enkomo na yesua ade ehu nia ebeboa ya apomuden na ye ha last week na ye di nkomo efa gonorrhea in men and then so ye ha ye besa edi nkomo afa the same gonorrhea but we eye yare bi sonkrokra ye say resistant gonorrhea. As usual, you will have with Dr. Grant to discuss about resistant gonorrhea. Come when na yema Dr. Akwaba. Dr. Yamawo Akwaba, ever health matters you may be so.
Yeah. If you are this, you come with different, especially seriously.
Baby pound.
Guy, yeah, ah, my signature, me say be guy. And then me wunu me yi. Yeah, my guy. Okay.
Thank you, doctor. Those was just by the way. Okay, doctor. I think that last week we had a discussion about gonorrhea in men, and then you see, before your friend is a resistant gonorrhea. But before we talk about it, me per se, you call aboa phone crack so kitwe bi eba. So when we say you do me so yeah, but last week and then you tinya ba. Na kyerɛ sɛ nkurɔfoɔ bi na asɔ yɛn mu ama yɛtumi de dwumadie yi ɛbrɛw na baako a ɔdi kan yɛ Eden Block Factory. Eden Block Factory. Ɛhɔ yɛ bea a yɛtɔn blocks ahodoɔ. Wɔyɛ concrete works ne adeɛ nyinaa. Sɛ wopɛ block a wode si wo dan a, anointing ɛwom. I mean anointing ɛwom because the block factory no ɛbɛn prayer camp. Our prayer camp ni munti you all be there dance say anointing ewom ebuama wodan no ekoye the quality of the block cement woman nye alo bi a ye de cement one bag extra block 60 no block and cement atinu mu a edimu nsuo to a ejina ne nan so ewiabo a ejina ne nan so enti se Upe blocks CBA, ubetimi afre omo ewo 0535 961 807 and now says 0243 964 264. Who friend number here? Baby, I will be omo the blocks no ebe bro ewo. Na ye fru na ye call fly trends collection. So we share t-shirt here e shemiya. Who say eye fe yie, eye quality, e di mu pan yie. If you fly trends collection and omo de atare fefefe yi e ma me. Sɛ wopɛ atare efiri wɔn nkyɛn a wobɛtumi afrɛ ɔmo ɛwɔ 0278 964 820 0278 964 820. They will be at your service. No ɔmo bɛma wɔ atare a ɛyɛ quality. Okay, we move straight to doctor. Now wama yɛ nkyerɛmu afa resistant gonorrhea. Doctor, ɛdeɛn na ɛyɛ resistant gonorrhea?
Yo, me that say resistant gonorrhea. Where they are resistant gonorrhea. Into your can church I say gonorrhea na to say last week can was no. I resistant. I kwanko and I say a kwan na den aba asonson no. No a in the tibia no I say abi wasonson no. What I say. So the gonorrhea has gotten resistance. It has become resistant. Nti I say obi say me go no ekwa na ade asamba akwa na asamba and then they ba be de abeka wan asem ha nti ka resistant gonorrhea gonorrhea as we said last week say gonorrhea is caused by bacteria nti the church signs and symptoms na there so this resistant one here you treat the first one but wasan enya say treat second one asamba biem as treat it and then they say
Nti doctor say can we also call it a chronic and
oh yeah can say chronic can dey aba I trust star but we know eba na ekwo and some condition no na grow I say into me treatment I don't grow resistance I was like into me treatment what the man be am so that and responded to it the sign of meeting aka no hwe kakra and you can resistance gonorrhea nakasa no one of the area World Health Organization in the year 2022 Omo ye estimate say nipa 82 million
Wow.
are new cases worldwide. No mutimi nya my friend is saying gonorrhea no. They even grew resistance to it. 82 million. One of the problems of concern, or let's say health concern, we need to really tackle it. What I said. And then you say do mu is how does it become resistant? How and when and what?
Thank you, Doctor. Yɛda wase paa wɔ nkyerɛmu a wɔde ama yɛn. But yɛpɛ sɛ yɛhu sɛ, how does gonorrhea becomes resistant? Yàrá ne deɛ menya, manum aduro, ɛkɔ, minim sɛ ɛkɔ, na asan ba. How does it, like Eban is saying, how does it become resistant?
Okay. I think so last week, you share me say, since gonorrhea bacterial infection, we use antibiotics. What I say? So we call something we call there's something we call drug resistance. First of all, the microbes na bacteria no develops an ability, what I say, to stop or destroy the drug sent to kill it. Bacteria no nkasa develop ability, we have features bi, we nya hoɔden bi a nduro na yɛde asoma sɛ ɛfa ko ku ɔno bacteria no ɔno mom etumi ɛhyɛ eduro no so. Na hoɔden no aboa no we develop ahoɔden ayɛ sɛ wafonso no nti sɛ we grow resistance to it. Na ɔyɛ ne sɛ eduro na wɔde akɔ nipadua no mu sɛ ɔno mom nko ku aboa no, it rather overshadows the drug. That's one of the ways, and in fact, that is the highest percentage where gonorrhea bacteria, and I say Neisseria gonorrhea, no, it grow resistance. Drug resistance, no, once a woman a grow now, to me, a grown to me in Kuabuano, now, so you and I say, Kobe, now, Koye, now, sign with time, now, sign your power, now, Saba, even much higher than before, no, and that's how. The resistance eba. I think say the kind of drug resistance first now in drug what made it to some yare. For example, first now your chloroquine and some malaria treatments most of the time when them so and the malaria parasites some resistance be changing handy. That's how the resistance we talk about eba.
Thank you very much, Doctor, for this explanation. Say gonorrhea, it's me irresistible a draw. It's me share a draw. So, Doctor, can we say self-medication? It's me causes idea no say like manum a draw, matuto a draw biano manti anko.
So now what is drug resistance no? Then can put it and quite a fast back. I don't know what kind. But we want self-medication, to say when we were talking about the gonorrhea signs and so on, say it may be seno. But we are not we're mistaking the area for gonorrhea and I say we have to know the type of bacteria to say oh yeah got some kind and I say I was jollof almost say chicken spice.
Oh yeah, chicken chicken spice.
Very good.
Oh yeah,
so what I say is bacteria na ye kan asem na cause gonorrhea no or say nya no we draw specific treatment. What I say but we say we treat different things. I say e draw na ye fa nya no ho dia but sometimes they are rather feeding on the drug. Who feels some woman a draw but they are rather feeding on the drug to grow. But you know what I say, and some combination of drugs be the mano. You know, so rather buano enya first no. Remember example. First no na your treatment method be the mabit say malaria untreated. Na your treatment is say malaria. Na you say uma mojedro na ade na, and so uma no indro na. Na the mojedro ade aka. Then with time we realize say what the mojedro no eka malaria treatment no. You are rather feeding the malaria parasite. What I say now then a change came say no malaria don't really answer na. So drugs na ye fam or onya gonorrhea and so onya infection bia no akọ to do bia ope no manom na ebi na afra na say incomplete treatment. Ono be 3 days I know I we try. Be 4 days 2 days no we try. So very good. See, I don't know no munya resistance, no grow resistance to the treatment that we are talking about.
Thank you very much, Doctor. Yeah, that was a pan say, yeah, woman in Chimu, Emma yet say, and your massy ye, even Diane Mufono, woman understanding to that. We are very grateful to you. Doctor say, yeah, Baby, my next question, by say, what happens when gonorrhea becomes untreated? A DNA say, Yareno uncle, and I say, you're treated. What happens?
Now, not gonorrhea there. You're in Tritia. I think it's the last time I will be so.
Yeah.
When Tritia, it will end to complications.
Yeah.
And just say gonorrhea never. No when Tritia, it will want to be a ectopic pregnancy.
Wow, as a woman.
Yeah, as a woman, it can lead to ectopic pregnancy because ama area hono are prone to infection. Fallopian tube now, ebe ma egg no, I drop it down to the uterus, the awodie no mu no, ma e develop no. You know, to be infected, and the movement say kesa dey infected. Fallopian tube now dey say a pulley egg no down to for the development in the womb. It's like a fault, yeah. Sɛ ntumi nyɛ n'adwuma.
Dase paa wɔ nhyiamu a wode ama yɛn. Nti me nuanom mmaa ne mmarima mɛsrɛ mo sɛ mo feel uncomfortable a because ɛyɛ a na yɛnnim deɛ a ɛyɛ yɛn ma yɛnyɛ self medication. Ɔmo se sisi a treatment no ɛyɛ IV ɔde aduro no bɛfa yɛn tiri mu and I don't think we can do that at home because okɔyɛ na sɛ wo nsa no ɛswɛle a ɛno nso yɛ another problem. So let's just go to the hospital. Sɛnea ɛbɛyɛ a yɛn nyinaa yɛbɛyɛ safe. Thank you. Okay, doctor, your final thing is preventive measures. Again, na yɛbɛtumi ayɛ a ɛmma yɛnya gonorrhea no deɛ yɛnya dada. But what are the things we will do a ɛmma ne yɛ resistant? How do we prevent ourselves from having this resistant gonorrhea?
As I have always stated, no, we treat or we do prevention according to causes. Say mechanical say misuse of antibiotics. So now we should say prevent it, say we grow resistance to, and say we resistant gonorrhea. We first of all have to make sure say we use prescribed antibiotics. So we should stop abusing antibiotics. Let me what I say. Men fact so don't just take any antibiotics without prescription because you are causing more harm than good. Avoid multiple partners. That's your favorite part. So we should avoid multiple partners. And we should also make sure that we have protected sexual intercourse. We should avoid unprotected. So we should, if we should avoid, what should we do? So we should protect. So you are asked your favorite statement is condom is not expensive. Okay. So I'm now learning from you. Condom is not expensive.
You can say condom is expensive chain pad. Pad is really expensive.
Okay. Because they know that it shouldn't be expensive than pad, so don't worry. So that we shouldn't how do you call it? Be reckless in sexual activity. Is that last week we mentioned? Don't just be reckless. 2 weeks there. So we can. When it comes to sex, don't be reckless.
Don't have it
rough and don't just be careful. Gentle and careful.
Gentle with a woman and be gentle to yourself.
You see, sex is not something that you just recklessly do. Either being careful or being gentle as you like. So they also pay gentle.
We are educating the public.
Don't worry, but
it's not a personal.
You stated that you want gentle but rough. Is that you want gentle but rough? So and lastly, what you have to do is you have to stay updated.
Okay.
Both read the medical personnel or even who you're about, you have to read more.
Yeah.
Stay updated to new trend of medication and revolutions. What did I say? Go on, man. Let's say I say on your infection, or so offense, a draw to go swim, hyper, no, transfer. No. This kind of things. Be updated, be current when it comes to some treatment. See, these are the preventive measures that we can take.
Thank you so much. God bless you. I don't know why this gonorrhea thing, no, and mommy is so emotional. Last week I was so down. Today too, I am kind of down a little bit. But then we are so thankful, said doctor. buy it, your tools are friend or buy it. And then we are so thankful for this program because it making us learn a lot and I know a lot about our health. It's system in your normal money bema. Wouldn't you be an answer what down for be away to me and share program way? Share link no emano and I said share video no man na on to me what is good for him or her to do. This year next week higher. It's my worry say we best subscribe to your YouTube channels. Now we're following your TikTok, any Facebook, and your Jehovah Nisi TV and a Health Matters platform our TikTok. Thank you, Macron.